Good evening, everybody. Thank you so much for joining us this evening for our Ask a Dietitian webinar. I'm Jeni Jones and I'm one of the nurses working for Pancreatic Cancer UK. We'll just hang on a couple of minutes just to allow people to join and get settled in, and we'll shortly begin with the programme. Well, it's fantastic to have you with us this evening. My name is Jeni, as I said earlier, and I'm one of the specialist nurses, one of 7 specialist nurses working on the support line for Pancreatic Cancer UK. We run a support line where we speak to around 2,000 people affected by pancreatic cancer in any way. And most of those have issues around diet, digestion, and a big topic is pancreatic enzyme replacement therapy, or pancreatic enzymes for short, and some of those could include Creon or Nutrizyme, but we'll speak more about those soon. I'm joined this evening by Lauren Roberts, who's a specialist pancreatic oncology dietitian at the Clatterbridge Cancer Centre, and also Rachel Caddy, who's a specialist pancreatic dietitian in Liverpool University NHS Foundation Trust. Both are excellent speakers and we look forward to hearing what they have to say. Before we get started, I have a couple of bits of housekeeping to run through with you. We will have a question and answer session at the end of the webinar. You should see at the bottom of your screen a box that says Q&A, a little icon, and it looks a bit like 2 speech bubbles. To ask a question, you can just type a question in there, and feel free to ask questions throughout the session. We will see them and we'll be able to answer them accordingly. Any questions that you will ask will be visible to all attendees, and you can ask a question anonymously if you'd prefer. You can also upvote your questions by clicking on the thumbs up button, and this will kind of boost them to the top of the list. And it may be that we'll lump some of the questions together if they're similar topics. There's also a chat function that you can make comments if you'd like to. If you're joining by phone and like to ask a question in the question and answers, please raise your hand by pressing *9, and then you'll be prompted to unmute yourself and speak. And for all participants joining online, please use the Q&A box. If you're joining from outside the UK, you're very welcome, but keep in mind that the information we will be giving will be based on the UK healthcare system, and we won't be able to advise individually on other options. The webinar is being recorded and will be made available on our website in the next few days if you'd like to watch it back or share it with other people who might be interested. Just a quick mention of some of our services. As I said, we run a support line, we provide information, we provide online support sessions, and we also have a discussion forum. And I'm delighted to also announce that we've just launched our new app called Medley. And this is a tool which will help you to share information, record information, and share with your healthcare teams who are looking after you as well. And it can be downloaded for free in the Apple App Store or Google Play. So if you feel like that is something you like to try out, then please go right ahead and download it. We would be delighted if you did. as I said, we do have some online support sessions which cover a range of topics: nutrition, pancreatic enzymes, symptoms of pancreatic cancer, chemotherapy, and social CUPPAs for patients, and also for carers, families and friends who might be also affected. And this is just a safe space for you to be able to speak about how things are going for you. Without further ado, I'm going to hand over to our first speaker, and that is Lauren Roberts. And I'm going to hand over, oh, sorry, it's Rachel Caddy, sorry. So I'm going to hand over to Rachel, and we will be delighted to hear from what she has to speak to us about this evening.
Hi there, my name is Rachel. I am a specialist dietitian working with people who are affected by pancreatic conditions in Liverpool. And I work closely with Lauren, who is a HPV oncology dietitian. So our session today is going to go through how we as dietitians work with people who are affected by pancreatic cancer, and how we may be able to help. So before we jump right in, excuse me. Have you or your loved one been able to speak to a dietitian following the diagnosis of pancreatic cancer? You should be able to vote on this. Nadia, are we able to see any of those results there?
Just getting it up now.
Perfect, thank you. Oh, great, they're coming in now. So it looks like about 55% of people have seen a dietitian, which is great, and kind of about 45% haven't at this stage. So that might have been a dietitian that you see in the hospital or maybe through your GP. But what we do as dietitians, bear with me. You should probably see the results there. So as dietitians, we are qualified to assess, diagnose and treat dietary and nutritional problems, and we're regulated by the Health and Care Professions Council. Now, when we as dietitians see somebody with pancreatic cancer, our aims are to build strength, so optimize what we call nutritional status. And this will help to optimize you as a patient for further treatment. So chemotherapy or potentially surgery. We know if someone's well nourished that they recover better from surgery, they recover quicker, and they can tolerate treatments like chemotherapy better. And overall, we're aiming as well to improve quality of life. So this is your pancreas here. It sits behind your stomach, and it's got two really important roles. One of those jobs is to look after our blood sugar levels by producing hormones. And one of the jobs is to help with our digestion. So when we eat foods, those nutrients are helped to be digested by the pancreas. Now, of the nutrients we eat, macronutrients are foods that we eat in large amounts. And these are carbohydrates, so potatoes, rice, bread, cereals, pasta, naan. And these will provide about 50% of our daily energy. We have protein, so foods like meat, fish, eggs, nuts, dairy foods, beans and pulses. And these are really important as they're the building blocks for our muscles. They build our strength. Proteins are also very important in terms of helping our body to heal. So after a wound has happened, so like following a surgery, protein foods help to heal those wounds. And fats. So fats are your unsaturated fat and your saturated fats. Fats are very high in calories, and they really contribute to adding flavor to food. And they're also important in terms of absorbing vitamins. So those are our macronutrients. So when we eat our food, it travels down the esophagus into the stomach and then through to the top part of the bowel. That's the duodenum. And this is where the pancreas will help to digest the food that's in the duodenum. So the pancreas creates something called enzymes, and those enzymes travel down that kind of middle road of the pancreas there. It's called the pancreatic duct. And those enzymes travel down that duct towards the top part of the bowel, the duodenum, where they can mix there with the foods that we've eaten, those macronutrients that we've eaten. And these enzymes are designed to break down those macronutrients. So amylase will break down carbohydrates, protease will break down proteins, and lipase will break down our fats. And that breaking down means that the pieces of the nutrients that we've eaten are small enough to allow our bowel to absorb everything properly. And that's called absorption. But when there's an issue with the pancreas, like there may be pancreatic cancer, what we might see is there is damage to the cells that make those enzymes. So we're not actually making enough enzymes anymore, or there's a blockage, like from a tumor, which means that the enzymes can't get to where they need to go, the top part of the bowel, that duodenum. So instead of those nutrients, those macronutrients being broken down, the pieces are now too large because the enzymes aren't there to break the pieces down properly. So what we see instead of absorption is malabsorption. And we see this quite regularly in people with pancreatic cancer. And symptoms that we commonly see with somebody who is malabsorbing are kind of greasy, oily, pale stools, loose, so diarrhea or very large volume, watery, sometimes very difficult to flush away. They can be very smelly. We can see abdominal pain, urgency, so having to dash to the toilet, feeling full very quickly, even if you've just eaten a small amount, and weight loss. And we're seeing these symptoms a lot in people with pancreatic cancer. So when somebody is malabsorbing due to the lack of those enzymes, this leads very quickly to malnutrition. If we can't absorb our nutrients, our body can't use those nutrients for fuel. So the body still needs to continue to work. And the way it then gets its fuel is by its own stores. So our stores of fat, but also our stores of protein. Now, our stores of protein are our muscles. So what we can see in somebody with pancreatic cancer who is malabsorbing is that they are losing weight, and they're losing weight very quickly, but they're also losing a lot of strength. And that is because you're not able to absorb your nutrients and your body's using its own stores as fuel. We know that this malnutrition is quite detrimental for somebody with pancreatic cancer because it can affect how well they're able to tolerate their treatment, whether that is something like chemotherapy or radiotherapy, or whether that's surgery. So as dietitians, what we're aiming to do is to stop or reverse that malnutrition, build strength as much as possible, and get you as fit as possible for your treatment that's upcoming. And one of the main ways that we will try and stop and reverse malnutrition is ensuring that people are prescribed pancreatic enzyme replacement therapy. So these are a replacement of the enzymes that the pancreas would normally make, and they come in a tablet form. So another poll here. Are you or your loved one taking pancreatic enzyme replacement therapy, such as Creon or Nutrizyme? Let's give you a couple more minutes just in case anybody else wants to vote. Okay. So from the results there, it shows that 86% of you guys are prescribed pancreatic enzyme replacement therapy. meaning about 14% aren't. So this is great for the people who are prescribed enzymes, but for those who aren't, then we'll excuse me, we'll go through why you need to take those enzymes and how you can go about getting those. So we know when someone's taking pancreatic enzyme replacement therapy, what we see is that they are absorbing their nutrients properly. So we see less or resolution of those symptoms of malabsorption. We see normal formed coloured stools again, weight maintenance or weight regain, and overall improved quality of life. And there's been research as well that's done in people who take pancreatic enzyme replacement therapy. And this has shown that they may have an enhanced quality of life, improved overall survival, obtain a better symptom score, and may tolerate their treatment better, such as chemotherapy or surgery. So how to take enzymes. So these are tablets that should be taken with every meal, every snack, every nourishing drink. Our starting dose in Liverpool is 2 to 3 25,000 unit capsules per meal, and 1 to 2 25,000 unit capsules per snack and per nourishing drink. If you are prescribed the 10,000 unit capsules, it's really important that you ask for an increase of that prescription to the 25,000 unit capsules, because this is the size of the dose that you need to take. So with all meals, all snacks, any nourishing drinks, and those nourishing drinks would include things like oral nutritional supplement drinks, anything that's milky, so a glass of milk, a milkshake, or anything that's made with more than half milk. So a cappuccino, a latte, a hot chocolate. You should always swallow your enzyme capsules with a cold drink, not with a hot one, as it'll stop your enzymes from working properly, and ideally swallow them whole if you can. If you're taking more than 1 capsule, so our starting dose is 3 capsules, what I'd usually say is spread through the meal. And how that would look like, it would be 2 capsules at the beginning and 1 halfway through. If you really struggle swallowing tablets whole, what you can do is open the capsules. The tiny microgranules then can be mixed with something acidic. Now that would be something like yogurt or chutney or fruit puree or tomato sauce. Mix those little balls with that acidic thing and take it all in one go. Rinse your mouth really well afterwards, because those little balls, they can cause some irritation if they're caught in your mouth. The acidic something that it's on, so the yogurt or the fruit puree, that helps to protect those little balls and make sure that they get to the duodenum, so the top part of the bowel, which is where they need to do their work. Make sure they're stored at room temperature. Don't let them get too hot. Don't open your capsules and sprinkle directly onto a meal. So don't put it on your fish and chips, because it will stop your food tasting terrible. It'll make your food taste terrible. It'll also stop the enzymes from working properly, because the heat from the food will damage the enzymes. If you're taking enzymes, but you're still getting those symptoms of malabsorption, we need to check if your dose is correct. So when I speak with patients, we talk about how to know when you need an increased dose of the enzyme tablets. And I would give ownership to the patient to make sure that they know how to do that, and they are happy to increase that dose on their own. And again, if you're seeing that you're increasing your dose, but you are still getting symptoms of malabsorption, you might need a PPI, a proton pump inhibitor. So that would be omeprazole or lansoprazole. And that reduces the acidity of your stomach, meaning that the enzymes can work a little bit more effectively. So enzymes are not needed when you're having a single portion of fruit or veggies, except something fatty like avocado. If you're having sugary sweets, so things like jelly babies, marshmallows, tea or coffee with just a drop of milk in, things like water, squash, fizzy drinks, wine, beer, you don't need to take enzymes with those. Or if you've missed a meal, you don't need to take enzymes. So I get some really common questions when I'm speaking to people about taking their enzymes. One of those is, can I overdose? So if you have pancreatic cancer and you're prescribed enzymes, there is no upper limit of the amount that you're allowed to take. What we're aiming for is to continue to increase the dose until the point that you don't have symptoms of malabsorption anymore. And that's the correct dose for you, but you can never take too many. Does PERT contain animal products? Yes, your pancreatic enzymes do contain animal products. They're made using pork products. So this is something that I will discuss with every person who started on enzymes. Especially if they choose not to eat meat as part of their lifestyle, or they don't eat pork as part of their religion. We'll discuss why they would benefit from taking those enzymes, and discuss how they may find it an acceptable option. If you don't have pork in your diet as part of your religion, then because the pork is contained within a medication that's essential, it's allowed within the religion, but just speak with your religious leader if you're uncertain. I don't have symptoms of malabsorption. Do I still need enzymes? Yeah, the pancreas is quite impressive in that we don't see those symptoms of malabsorption until it's working at about less than 10% of it, how it would normally work, so less than 10% capacity. So it's kind of masking that malabsorption for a really long time. So even if you're not seeing symptoms of malabsorption, you are likely to be malabsorbing to some degree. So even if you're not having those symptoms, those kind of greasy, oily stools or bloating or weight loss, we still recommend taking enzyme tablets to stop malnutrition or reverse if you already have any, and build that strength as much as possible. Should I follow a low-fat diet? So some of the really unpleasant symptoms of malabsorption are due to malabsorption of fat, so the kind of greasy, oily stools that are difficult to flush away and very smelly. That's a malabsorption of fat. But we know if you're malabsorbing one of your macronutrients, your fat, then you're also malabsorbing your others, your carbohydrates, your proteins. So rather than taking fat out of the diet to stop those kind of overt symptoms of malabsorption, what we say is keep your fat in your diet. It's so important for calories and for flavor and food enjoyment, but make sure that you're taking your pancreatic enzymes at the right dose to make sure you're absorbing all those nutrients. I forgot PERT with my meal. Should I take it now? So I'll normally say if it's anything longer than about 10-15 minutes after your meal, and you've forgotten, then don't worry too much this time, but try and figure out a way to remember next time. So can you set an alarm when you have your meal to remind you to take your enzymes? Or can you put the bottle in front of the TV if you eat in front of the telly, or in the middle of the table next to the salt and pepper? Or can you remind a loved one to take their enzymes, just to make sure that you're consistently taking them? So as dietitians, as I briefly mentioned before, what we're trying to do is build strength as much as possible so you can tolerate your treatment better. So whether that's surgery or chemotherapy. If someone's having a surgery, we know if they're well nourished, they recover better. If someone's having chemotherapy, if they're well nourished, they tolerate it better. And overall, this can help to improve quality of life. So with our dietary recommendations, we essentially say eat anything. There's nothing that is off the table. We want you eating regularly, so ideally 3 meals a day, a couple of snacks, and a pint of nourishing drink daily. So that would be something like full fat milk if you can. Be aware that some choices are more nourishing. So things like your carbohydrates, they are providing your energy. Your protein provides your strength, helps to build your muscles back. And it's also really important for that wound healing. Try and aim to have 2 or 3 portions a day of those protein foods that we talked about before. Your fat, it adds a flavor there. Your calories, it's got lots of calories. It really contributes to the enjoyment of your food. So include that as much as you can. And you can also enrich and fortify your food, which we're going to go into in the next slide. And then you can use nutritional supplement drinks. So this could be drinks that you make at home. So full fat milk with ice cream, milkshake powder, some fruit in there, some additional milk protein powder, so skim milk powder, or nutrition drinks that you buy, so things like Complan or Build Up, or prescribed nutritional supplements. They're all really good options to help supplement what you're eating, get extra calories, extra protein. Remember, these drinks are going to need pancreatic enzyme replacement therapy, so treat them as a snack. So whether they're juice-based or milk-based, treat them as a snack and take your enzymes to absorb all those nutrients that are in that drink. So enriching food is the process of adding additional calories, protein to get as much out of your food as possible. So choose full fat options always, and where possible, add if you can. So add skimmed milk powder for extra calories and protein. So into things like porridge or soup or puddings or mashed potatoes, things like butter or cheese into mash or soup. And then additions, so things like condensed milk, honey, dried fruit onto things like cereal or yogurt or porridge. And these all add extra calories, extra protein, and it can really make a difference. If you're enriching your foods, what we can see is that you're getting lots of extra calories and protein. So comparing these 2 days here, so we have kind of standard day A and an enriched day B. And we're seeing your kind of additions. So skim milk powder into porridge, adding grated cheese into the tomato soup at lunch, fortifying that mash with the shepherd's pie, so additional milk powder, cream cheese, whole milk, choosing nourishing drinks like milky coffee or Bovril. And what we can see is We can double the calories, double the protein when you're not increasing the volume of food particularly. And this is really important because what we're going to do is build your strength, get you stronger, get you fitter, get you tolerating that upcoming treatment better. The British Dietetic Association has a really useful diet sheet called Malnutrition on their website, the British Dietetic Association. So try and hunt that out if you can, and that gives you more fortification tips. And then quickly, type 3C diabetes. This is the last part of my section here. So as we said, the pancreas also has an important role in looking after our blood sugar levels. It produces hormones, insulin and glucagon, and these work to balance our blood sugars. If the pancreas is damaged and it's not making enough insulin anymore, then that means it can affect your blood sugars. Insulin works like a key. So when we've absorbed all of our nutrients, insulin will come along and act like a key to open our cells and allow the nutrients then into the cells so they can be used as fuel. If you're not making enough insulin because there's damage to your pancreas, then the key isn't there to open the cells and the nutrients just stay in your blood. And this causes high blood sugars. And this is when you've been diagnosed with type 3C diabetes. Diabetes, so high blood sugars, relate to your pancreatic cancer. Because we're not able to use the nutrients from our food, it's sat in our bloodstream and not in our cells, it can make our malnutrition worse. Symptoms of high blood sugar include urinating a lot, especially overnight, feeling very thirsty, non-healing wounds, and weight loss. And be aware that starting your enzymes might unmask your type 3C diabetes. So now you're absorbing your nutrients, we might then realize there isn't enough insulin to deal with those nutrients. So be aware of those symptoms of high blood sugar. The way we manage type 3C diabetes is medication, so oral or injectable, monitoring of blood glucose levels, and maybe some dietary changes, but if somebody's malnourished, we'll never restrict what they're eating. What we like to see is that medication is matched to what someone's eating. We never want people to restrict their food intake. And this is what a day's food might look for somebody with type 3C diabetes due to their pancreatic cancer. So regular meals, so 3 meals a day and a couple of snacks. And if someone's eating really well, what we might say is be aware of very high GI foods. These are foods that are broken down really quickly by the body, and it causes a big spike in blood sugar level. Rice, or things with like additional sugars, so chewy sweets, for example. And what we might say is focus a little bit more on lower kind of GI foods or whole grain foods, so things like oats, pulses, fruits, vegetables. These are broken down much more slowly. They have less of an impact on your blood sugar levels. And it just causes a gradual rise, which is helpful in terms of managing your blood sugar levels. And that's me. So what I'm going to do now is hand over to Lauren, who'll run through the cancer treatment and diet section.
Thank you, Rachel. Just bear with me while I share my screen. Okay. So I'm Lauren Roberts. So as Jenny and Rachel have previously said, I work as an oncology specialist dietitian at the Clatterbridge Cancer Centre, and the majority of my work is focusing and working with pancreatic cancer patients. So I will chat to you about cancer treatment and diet this evening, and sort of strategies really to help cope with treatment side effects as well. So over to you guys to start with. So if you could share your experiences. Have you or your loved one with pancreatic cancer experienced any difficulties with eating and drinking? And you should get some options pop up on your screen shortly. Give a few more minute or so to let people finish. Yeah, so I think, from this we can see that 95% have said yes, you or your loved ones have experienced difficulty, which I think just highlights, how much of a battle sort of eating and drinking it can be sometimes with pancreatic cancer and when on treatment. And there you can see. So in terms of, sorry, just move that out of the way. So, I mean, in terms of cancer treatment and diet, we know that in cancer, particularly pancreatic cancer, that our body sort of energy needs are a lot higher because of the tumour itself. And also that coupled with treatment side effects can make sort of eating and drinking very difficult and maintaining weight and that muscle very difficult that Rachel's previously talked about. We often find that patients say that sort of eating can often be more of a chore or a task rather than a pleasurable experience. And we know, as Rachel said, that eating a nutritious diet through cancer treatment can help in many ways. So we often see in clinic, we can help to minimise and prevent weight loss. We can help minimise delays in treatment. Being well nourished and eating well can help reduce treatment related side effects. And we know it from studies and from what patients say that when they're eating well and are sort of well nourished, that helps with quality of life and can also help with overall survival as well. So, there can be many sort of problems and side effects that come with treatments that can impact on appetite and eating. Cancer and cancer treatments do affect everybody very differently. And we know that, everybody experiences, side effects in different ways, and it can vary from person to person. And there is side effects with all types of cancer treatment we offer for pancreatic cancer, whether it be surgery, chemotherapy or radiotherapy, for instance. In terms of side effects following surgery, so these can include, feelings such as feeling full quite quickly, what we call early satiety. You may get sort of diarrhea and increased sort of malabsorption, which Rachel's talked about. Nausea and vomiting, particularly early on following surgery, can occur sometimes. Reduced appetite, again, is quite common, as well as sort of taste changes and also fatigue, or that tiredness and that lack of energy can also be experienced. We know that eating well as possible, before surgery and also after surgery can help with recovery. It can help those tissues to heal, and it can help you regain that strength, back that you need. And that's, very important in general, but also particularly more so important if you're then going on to have chemotherapy after surgery. In terms of side effects with chemotherapy, so in terms of chemotherapy and how it works, the drugs, don't just target the cancer cells, but they also target healthy cells within our body. Whereas unlike surgery or radiotherapy, for instance, they are more local treatments and will sort of affect, that area in question. The chemotherapy works and travels around that whole body. So it can affect cells all through our body, from mouth down to the gut. And the effects of chemotherapy as well can build over time. So they have a cumulative effect, if you like. So, you may be absolutely fine on chemotherapy to start with, but the more sessions and cycles of it you have, sometimes side effects can then build up from that. So side effects, I mean, some are very similar to what you can experience with surgery, but also to add, you can also get sort of sore mouth, dry mouth, Sometimes you may develop sort of ulcers. Taste changes is a very common one, as well as fatigue, and also sort of diarrhea, nausea and vomiting, which all then contribute to that reduced appetite and interest in food. And if you do have radiotherapy as part of your treatment plan for pancreatic cancer, side effects again are quite similar as they are with chemotherapy and surgery. But also sometimes patients complain more of sort of gas and bloating and sort of gastrointestinal symptoms with radiotherapy, as that's where the treatment is targeting. So in terms of strategy, so we'll talk through side effects and strategies to sort of help manage these as best as possible. And this is a big sort of role that I do in clinics with pancreatic cancer patients. I'm often working with them on the treatment units and within the oncology clinics with the oncologists to try and get patients optimized as much as possible for treatment. So in terms of reduced appetite, so changes in appetite, as Rachel and I have spoke about, is very, very common. And as highlighted from the poll we did, majority of you or your loved ones have been experiencing changes or difficulties with eating and drinking. And sometimes reduced appetite can be the first sign that something's not quite right before you actually get the diagnosis of pancreatic cancer. And as Rachel's touched on, we won't go through this again, but food fortification is really, really important. So we spend a lot of time, educating and talking about that in clinics, as well as adopting that little and often approach with sort of food and meals. So going for smaller portions, but more frequently through the day. So trying to eat 5 to 6 times through the day on small nourishing portions of food. With reduced appetite, we would suggest and advise sort of not filling up really on non-nutritious drinks, particularly sort of fizzy drinks, lots of tea and coffee, non-nutritious soups, but opt in for those nourishing ones, whether it be supplements or full fat milk or other nourishing drinks, sort of hot chocolates, cappuccinos, etc. It's really important you go for foods that you fancy. It may not be the most healthiest all the time, and that's absolutely fine. Our main aim at the end of the day is to get you eating more and get you eating better. And it's really important that you make the most out of when you're hungry or during the day or times of the day when you have the best appetite, and really try and pack the calories and the goodness in during those times. Blander or softer foods may be better tolerated. So some patients say when they haven't got an appetite and don't really want to eat, that softer foods that require sort of less effort to chew or that don't have much taste to them can sometimes be easier to get down. In terms of other side effects, so feeling full quickly or early satiety is particularly common, particularly after pancreatic surgery, but also with some chemotherapies as well. So again, we would be going for that little and often approach. Avoid filling up on fizzy drinks or gassy drinks that can make you feel quite bloated. Try not to drink too much before you sit down and have a meal or a snack. Otherwise, you may struggle even more to finish that portion. And again, go in for higher energy and protein fluids, such as those milk-based drinks, supplements, enriched soups and smoothies, for instance. So nausea and sickness are very common side effects through chemotherapy. The severity can vary from person to person, really. So that nausea, so that term nausea is when you sort of have that feeling of sickness, or you have a sort of an unpleasant feeling in your stomach or throat. We do provide sort of anti-sickness medications as part of chemotherapy regimes for you to go home with to help manage that nausea and sickness. And I must say, getting that anti-sickness or that medication right can really make a big difference to how much you can eat sometimes, and the impact that can have on your appetite can be quite drastic and quite good at times. There are lots of anti-sickness out there, so again, it's finding the right one for you, as the first one, you know, you may get given might not be the right one. Strategies that you can try to help manage nausea and sickness. So we would say trying not to skip meals or go long periods without eating. Often, you know, having an empty stomach can make nausea and that feeling of sickness worse. We would encourage you to eat slowly and in small amounts. Some people say that plain foods that are quite complex carbohydrate based, such as toast, bread, biscuits, pasta, crackers, for instance, are better tolerated when they're feeling sick and nauseous. But others also say that colder foods work better. So things like yogurts, you know, cold custard, creme caramels, puddings, that sort of thing. We also advise to avoid sort of cooking and staying away from kitchens and cooking smells when you're feeling sick. So it might be that you ask a loved one or a friend to cook for you, or it's also quite useful to make use of ready meals or more convenient foods when you're feeling sick or nauseous as well. Some patients find sipping on cold fizzy drinks between meals can just settle their stomach sometimes. And also, you know, salty foods as well. So some patients say that salty foods, such as crisps, handfuls of sort of salted peanuts or nuts, for instance, can just help settle stomach as well. We would avoid advise to avoid really greasy foods or really spicy foods with strong smells when you're also feeling nauseous or sick. And also ginger as well. So going back to those old wives' tale about ginger, you know, ginger biscuits, ginger ale, ginger beer and tea can also be quite useful for some patients. I'd say from experience, not everybody has improvement in nausea and that feeling of nausea with ginger, but it does work for some, so it's definitely worth a try. So sore mouth and dry mouth, again, are quite common chemotherapy side effects. So I've coupled the strategies at the top, which are useful for both sore and dry mouth. So it would be going for your softer, your moister foods. Sometimes blander foods are easier as well. Using lots of sauces, gravies, you know, just to help make those foods moist and soft. If you've got a sore mouth or dry mouth, obviously sipping fluids regularly is really important through the day. If your lips are sore, some patients find trying a straw and sucking fluids through a straw quite useful as well. Cold foods can also be quite soothing, such as ice cream, yogurt, for instance, for a dry and sore mouth. Particularly for sore mouth, it would be looking at avoiding sort of dry and rough foods, such as sort of nuts, muesli, tough bread, for instance. And also citrus foods or tomato-based sauces can sometimes sting and aggravate the mouth a little bit more. You might also want to look at reducing sort of salt and seasonings if they're aggravating as well. And in terms of other strategies for a dry mouth, so some patients find sucking on ice lollies, frozen fruit, for instance, or ice cubes quite useful. It's really important as well that you maintain good oral hygiene, so regular teeth brushing and making sure that your mouth is nice and clean. Often patients on chemotherapy or treatment are more prone to infections, and that includes things like fungal infections like oral thrush. So and that can really affect your mouth and cause sort of a dry mouth, and can also cause a nasty taste as well. So it's really important you keep your oral hygiene, you know, maintained, and you're checking your mouth regularly as well. And, you know, oral thrush is treated through sort of antifungals that your oncologist or GP can prescribe. Sometimes alcohol and caffeine can also dry out your mouth, so it would be avoiding or limiting those through treatment. And others find that rinsing your mouth before meals with sort of fluids like flavoured fizzy water, sparkling water, or some patients like dipping a bit of sort of lemon or lime in hot water and drinking that before meals, quite useful. And that just starts to stimulate the saliva a little bit more to get that taste and get that mouth nice and clean. And you can also get artificial saliva prescribed either through the GP or oncologist if you're really struggling with a dry mouth. So in terms of taste and smell changes, so these are really, really common on treatments, oncology treatments. And I'd say they're one of the biggest complaints that I come across with my patients in clinic. They are quite difficult to deal with, and they are obviously a result of the cancer treatment itself, but also medications can cause changes to taste as well as oral thrush, which we've talked about before. You know, patients often say that they, you know, foods that they sort of once enjoyed they find sort of less appealing, really. Foods can taste bland or tasteless, which makes eating that extra bit harder. I would say that sort of dealing with taste changes does require a lot of sort of patience, really, and willingness to try new flavours in the food. We often see, and you know, from experience, taste and smell changes usually change over time. So some experienced early in treatment might not sort of persist or carry on, if you like, although new taste and smell changes can sometimes come later down the line. So I would recommend keep trying foods at regular intervals, every sort of 2 to 3 weeks, as our cells and our taste receptor cells in our mouth and lining, you know, start to regenerate. So it might be you get back some of those tastes that you once enjoyed. It's important to obviously try new foods, and as I say, try at regular intervals with old foods that you once enjoyed. Food presentation can help sometimes, and as I say, monitoring your mouth and tongue for any signs of thrush as well that can be treated. In terms of specific strategies, so we've just put a few here in summary. So, you know, if you're getting that sort of bitter or metallic taste with treatments, it might be that you want to start looking at marinating sort of meats or foods in fruit juices or other sauces. That fruity sort of flavour can sometimes counteract that bitter taste at times. It might be that you want to consider alternative protein sources to meat, as meat can often leave a bit of a bitter taste. So go in for alternative protein sources like fish, eggs, lentils, yogurt, cheese, for instance. As we've touched on before, rinsing your mouth with sort of flavoured sparkling water before food or a sharp tasting fluid can get that sort of stimulate that saliva flow and can sometimes make food taste a little bit better. Some patients say that actually trying plastic utensils instead of metallic utensils can take, you know, that sort of metal taste away at times when they're eating. So it may be worth a try. And also going for sort of sweeter drinks as well as alternatives to tea and coffee. That can be quite bitter tasting or leave a bitter aftertaste, can be quite useful. And as we've said, sucking on sort of sharp tasting sweets as well before eating can sometimes help reduce bad taste and again stimulate that saliva. So food doesn't taste of anything, it tastes bland. So this is, you know, a very common complaint in my clinics. Again, it would be going for those, you know, meats that are marinated. It might be that you want to add sauces and dressings, so chutneys, mustard, balsamic vinegar, for instance, using strong or sharp flavors, so mustard, you know, spices, chili flakes or powder, for instance. Usually warm or hot foods are better tolerated. I think our taste buds readily detect these temperatures a little bit better, so you might find those types of foods more tolerable than cold. And you know, foods that need a lot of chewing increase saliva production. So it might be that you want to sort of over chew at times just to see whether you can stimulate that and get a little bit of taste back. So diarrhea again can be a common side effect of all treatments really, whether it be surgery, chemotherapy, radiotherapy. With obviously chemotherapy, that gut lining is irritated. We often again give medications to manage diarrhea when you come for treatments. So that might be something like Imodium or loperamide. Sometimes you can see, you know, similar patterns with diarrhea on chemotherapy. You know, some patients like to keep a diary just to see and find patterns like that. But also what I'm looking for, particularly when patients come to clinic that have diarrhea, is making sure that they haven't got diarrhea that is a result of pancreatic enzyme exocrine insufficiency, which Rachel has talked about. So I'm making sure that those doses of creon or Nutrazyme enzymes, for instance, are correct, and making sure that we don't need to adjust those, as sometimes that diarrhea can be malabsorption rather than treatment related. So in terms of managing diarrhea and what you can do, it's important to keep hydrated, so frequent sips throughout the day, and those flat sort of energy sports drinks can be quite useful. Again, we would be wanting you to eat little and often. Some patients find that limiting high fiber foods, so all your sort of whole grains, beans, lentils, you know, fruit and veg, particularly raw, limiting those for a period can sometimes help settle their bowels a little bit. Also avoiding very greasy or fatty foods during this time, and citrus foods and caffeine can sometimes aggravate bowels as well. So, I mean, dealing with cancer and obviously undergoing cancer treatment can be, you know, particularly draining. You know, fatigue from treatments can build up over time, particularly with chemotherapy and radiotherapy. And, you know, this can have an impact on your appetite, which then can contribute to weight loss as well. You know, you might not have the energy to go food shopping, or you might not have the energy to cook, or you might not have the energy to even sit down and eat that meal once it's been prepared. So it's really important, you know, if you've got friends or family, you know, rely on those. They you know, they always want to help. Ask if they can go and do your food shopping or can prep some meals for you. We would be advising obviously maybe to look at online food shopping, so it's delivered to your door, to save you, you know, a little bit of energy and having to go out when you're not feeling well. If you do have energy or good days, you know, it's thinking about whether you can prepare meals or batch cook and then freeze meals, so you've got supplies and food in, you know, for those days where you're not feeling as good. And also sometimes we do have to rely on oral nutritional supplements if you're really struggling with fatigue and sort of meal prep and getting meals down. But also there's services like Wiltshire Farm Foods and Oak House as well, which can deliver meals to your door, and they often do like petite or small appetite ranges as well. It's also important to mention, and we do talk about it in clinics, that a little bit of light exercise can be beneficial, and there is evidence and studies to say that actually a little bit of exercise here and there can help reduce fatigue, and it may also stimulate appetite a little bit as well. It's also important to obviously touch on the emotional impact of eating. So, you know, eating and food, you know, is a daily activity, isn't it? It's a big part of our lives. It's a big social activity. Often there's a lot of stress from patients and loved ones, you know, about concerns about not eating the right foods or not eating enough. Sometimes patients are upset because they're getting pressure from family and friends about not eating enough. So we always say, you know, it's important to sit down with your loved ones and just explain about how you're feeling, and how to go about managing meal times. Really, you know, it might be that you want to discuss, you know, times of day where you feel appetite's better, and that's the way, you know, that's the time to get foods in. It might be that you need to change sort of meal times to suit you, or routines or patterns as well. And, you know, it's important to set realistic goals as well. You know, even eating small amounts can be a great achievement when you've not been eating hardly anything at all. You know, gentle support from and encouragement from friends and family is really useful, and without going too over the top. You know, we often find sometimes that pushes patients away further. And we've talked about obviously activity as well, you know, in helping to maintain strength and build your appetite back up. And in terms of goals, you know, it's considering what your goal is really. You know, someone who's building up their diet and strength for surgery will have very different aims really compared to somebody who's, you know, unfortunately not able to have surgery, and the focus is more on sort of, you know, maintaining quality of life and well-being really. We've just put some useful sort of recipe resources there as well, just for your reference, for you to go and have a look at if you're interested. Just want to touch on duodenal stents and diet as well. So this is, you know, something I spend quite a lot of time in clinic with patients as well. So if, you know, you've got sort of cancer in particularly in that head of the pancreas part, what can happen sometimes is that it can start pressing on that small bowel. And as Rachel's talked about, you know, our food travels down our stomach and into the duodenum, that small part, the small bowel. So if the tumour is pressing on that small bowel, it becomes narrower. And what that means is sometimes food and fluids cannot go down as easily as they would normally. It might be that the tumour itself is completely pressing on the small bowel and nothing's able to get down nutrition wise. And that can often lead to sort of nausea, vomiting, as all of that food is starting to back up in the stomach then. So one of the ways to manage a duodenal obstruction is what we call it, or a gastric outlet obstruction, is by placing a duodenal stent. As you can see from the picture, that's the part in yellow here. And what I say it almost looks like is if you take the spring out of a pen, for instance, it can almost resemble something like that. So that can be passed down, and it starts to open out that duodenum, that small bowel again, to allow for food and drink to travel down the duodenum and the rest of the gut as well. So there are recommendations after you've had a duodenal stent, and in an ideal world, you should be seen by a dietitian once you've had this procedure, or given advice or literature on diet and how to manage this. So often on day one or the day of stent, after having the stent, you would be on sort of fluids only. That might be oral nutritional supplements, sort of ice cream, jelly, smooth or thin soups. If you're tolerating that okay, and you're sort of not vomiting and everything's going well, you would then progress then onto more of a soft or a moist diet. We would encourage you with a stent to be chewing your food well and taking your time to eat. So it can take up to 3 days for stents to expand fully and settle down. And sometimes you can still feel quite nauseous or sick after this procedure. So it's really about taking your time and also sitting as upright as possible when you're eating, and avoiding lying flat after eating for half an hour to an hour or so. And again, we would be encouraging that little and often approach with diet, so eating small, sort of 6 small meals per day. I've just put here an example or examples of sort of a soft diet sort of meal routine for your reference, which you can have a look at later. I won't go through it in detail now. There's also specific recommendations and foods that you do need to avoid with a duodenal stent to avoid blockage. So they include sort of raw vegetables or vegetables that are really hard to digest. So it might be salad, for instance, celery, green beans and sweet corns. So they're big culprits. We would be getting you to avoid nuts or dried fruit with a duodenal stent. Watching fruits as well with skins and piths, so things like oranges or grapefruit can be sometimes problematic, and tough and gristly meat as well, so making sure your meat is nice and tender, it doesn't have any gristle, fat or skin on it. Bread as well. So bread's a funny one, so it can expand in your stomach and become quite stodgy, and that can be problematic with stents as well. And also whole grain foods, so whole grain sort of pastas, rice, are generally more difficult to digest. So sometimes we will get patients to switch to sort of white varieties. And also sipping fluids through meals and also after eatings, just to make sure everything's moist and washed down well. So in terms of other dietary considerations, I mean, I think it's just important to mention there is a wealth of information on the internet. Some is particularly helpful, some is not. You know, and there's lots of information out there on diet and pancreatic cancer, and you know, there's myths out there on, you know, foods to sort of cure cancer or reduce risk. You know, while some is useful, a lot is not evidence-based. So I would encourage you to sort of discuss anything that you've read with your oncology team or dietitian, if you have one. It's, you know, important that you're not unnecessarily restricting your diets, particularly when you're on treatment for pancreatic cancer. As we know, eating and drinking is obviously challenging enough as it is. It's also important to let your oncologists know or dietitians know if you're on any other supplements. So some high dose antioxidants, coenzyme Q10, selenium, vitamin C. Some can interact with chemotherapies or stop them from working as well. So just run those past your team before you start taking them. Standard dose sort of A to Z multivitamins and minerals from supermarkets and chemists are absolutely fine, and actually we would encourage them as dietitians, you know, for you to take one of those on a daily basis, given the risk of malabsorption with pancreatic cancer. Okay, and we've just put some information there if you want further resources. So Pancreatic Cancer UK is a good one. Also British Dietetic Association, so that's got the food facts and nourishing sort of meal ideas that Rachel's discussed, and also NHS choices as well. So to conclude, malabsorption can cause malnutrition. So we can correct malabsorption by making sure that you are taking sufficient amounts of pancreatic enzymes and you're taking those correctly. Dietary restriction is not appropriate in patients or people who are malnourished or at risk of malnutrition. And it's important that we use your pancreatic enzymes and you adopt a nourishing sort of meal pattern and strategies to help with your weight and help aid cancer sort of treatment tolerance really and overall well-being. And try different strategies as well to help manage any treatment side effects. And please seek advice from a dietitian or specialist nurse if you're struggling. And finally, always try and use reputable information and sources where you can. And if you're unsure, speak to a healthcare professional. And that's it from me, guys. Thank you very much.
Oh, thank you so much, Lauren. Wow, you've just gone through so much there. So we're really grateful. Give you a chance to catch your breath. My favorite quote from that presentation, I think, was even eating a small amount can be a great achievement. And I think that's something that everybody should remember. When you're having maybe days where you're only eating a small amount, it is still a great achievement. So without further ado, we will dive into our many questions, of some great questions here, but I'm going to allow Lauren a chance to grab a breather after that amazing presentation. And Rachel, would you mind answering the first question for us? And I believe it will be quite a nice, easy one for you to answer, which is, how is pancreatic exocrine insufficiency diagnosed?
So there is a test for the diagnosis of pancreatic exocrine insufficiency. So that would be exocrine insufficiency is the pancreas not being able to produce enough of those enzymes. So the way that it's diagnosed would be with a fecal elastase test. So this is a stool sample that is taken and assessed to check for elastase, and this is an okay marker of the function of the pancreas. So that can be used to diagnose pancreatic expanding insufficiency. That said, if somebody has pancreatic cancer, certainly within our trust, we will normally go off those clinical symptoms of malabsorption. So that would be things like your steatorrhea, so your greasy, oily, pale stools, or your diarrhea, or your bloating, or urgency, or your early satiety. We'll use those clinical symptoms alongside that diagnosis or potential diagnosis of pancreatic cancer, and essentially assume that you have got some exocrine insufficiency. And then that would mean that you are started quickly on your enzyme replacement therapy, and we're not waiting for that result back when we know it's likely that you're going to be malabsorbing to some degree.
That's fantastic. Thank you so much, Rachel. If I can just direct this one to you as well. This is from Mark. He says, I've had surgery in 2020 and chemo in 2021, but have had major digestive problems ever since. In the last year, I've increased my creon, now 6 to 8 capsules per meal. I would imagine that's 25,000 units, hopefully. I've started on insulin and recently tested for SIBO, which I will explain is small intestinal bacterial overgrowth for anybody who doesn't know, as well as a colonoscopy. What can I do next? Is it just a case of trial and error with diet? So quite a lot in that. If you need me to repeat it, just let me know. Otherwise, give me a thumbs up that you've got all that, Rachel.
Yeah, I'll give that a go. I've got it up here on the screen as well. So I guess I think we have to understand what the digestive problems are. I'm presuming that there's going to be some symptoms of malabsorption there. So I'm presuming maybe some bloating, some diarrhea, steatorrhea, because we're seeing an increase in the creon. It'd be interesting to see whether those symptoms of that he's getting the digestive problems, if they are resolving or they're still as bad as they ever were. Because if we're seeing that someone's symptoms are improving with that increase in dose, but they're not quite resolved yet, what we'd say in that instance, probably continue to increase, make sure that you're taking them correctly, and make sure that they're being stored correctly, like I talked about in the first section there. If we're seeing that with the increase in the dose of the creon, we're not seeing any improvement, it might be that this isn't the reason for those digestive problems, hence why testing for the bacterial overgrowth with the colonoscopy. What I might say is, if you're not taking a PPI, speak with your doctor and ask to be prescribed a proton pump inhibitor, omeprazole or lansoprazole. That will make your creon tablets work better, more effectively, and we might see an improvement in those symptoms there. So certainly do that. If that's, again, not making any help, some people find it really helpful to try a different type of enzyme. So creon is one type of enzyme, usually the one that is started first. But if someone isn't tolerating this well, which does happen, what we say is try an alternative. So something like Nutrizyme would be the next step. And what we see sometimes that people tolerate Nutrizyme much better than creon. So that might be something to try as well. I hope that's helpful.
And of course, hopefully, we don't know whether the result for SIBO has come back or not. So we will see that it could possibly be something else, which is another route to follow, of course. After you've increased creon and changed it, etc., there may be another source. So hopefully, let's see what happens with that for you. And you can always contact us on the support line should you need to. I've got some questions from Frederick. So the first one is, I'm going to read them together so that we can answer them together. No, it's disappeared. Hang on a second. I've been taking creon for 2 months and gradually increasing the dosage. I'm now on 10 per meal and 5 with snacks, and that is 25,000 units. Thanks for that. if my medication, i.e. Creon and loperamide, does not reduce diarrhea and steatorrhea, is there an alternative treatment or test? And he's also asked, is it usual for him to be still having problems with that amount of Creon? So hopefully I've got them all there.
Yeah, I've got them up here as well. So what I would say again, is that symptom improving? Like the symptoms, are they improving at all, or are they still as bad as they ever were? Try again with the alternatives. So try with Nutrizyme if you're able to, and are you on a PPI? What we might see is that those the diarrhea and the steatorrhea may improve with the alternative enzymes. But then the next step could be, if you're on a PPI, you've tried alternative enzymes and you're not seeing any improvement, and you're still kind of ramping up your dose. If you're not seeing any improvement, it would be potentially going down the route of testing for bacterial overgrowth, or some people have bile acid malabsorption. There's also a test for that, which gives similar symptoms to malabsorption due to pancreatic cancer. So there's other potential things that it may be, but what I'd say first is try the alternative enzymes. Have you got a PPI? Are you taking it correctly?
Can I also add as well, it might be worth getting a stool sample done. So sometimes we do see infections like C. diff, you know, alongside sort of pancreatic exocrine insufficiency, and we sometimes assume it's that or chemotherapy diarrhea, but sometimes it can be another infection as well.
Absolutely. We mustn't forget the basics as well, go back to basics. So we've got a question here regarding the amount of enzymes a healthy pancreas produces. I've read somewhere that a healthy pancreas produces 720,000 units of lipase per meal, whereas the Creon dosage you mentioned only contains up to, I think that should be 25,000 units, because that's the highest brand of capsule, highest amount. If these figures are right and the Creon dose is sufficient for full absorption, why does a healthy pancreas produce so much more? Or is it the case that even when taking Creon, the food still contains nutrients that would have been absorbed with a healthy pancreas? Interesting question.
Yeah, that is a really interesting one. Yeah, the healthy pancreas does produce a lot more units of lipase than we would give with Creon. I suppose what we have to take into account is that, you know, the pancreas, when it's working at its optimal level, it's working as well as it can do. But what we're trying to do with Creon is to do enough. So we're giving you enough enzymes to make sure that you're absorbing enough nutrients to either stop malnutrition and ideally reverse malnutrition. You know, it would be very difficult for someone to take 720,000 units of worth of Creon capsules, because it would be a huge amount of tablets that you need to take. But if we're doing enough, so you're taking, you know, the dose that's right for you, that's exactly what we're aiming for at this case. It might be that, you know, I think the last part of the question there was, you know, in the case, even when taking Creon, the food still contains nutrients that might have been absorbed with a healthy pancreas. It might be that you don't absorb absolutely everything from the food that you're eating. And this is why we have to take into account what your symptoms of malabsorption are, but also other factors. So what your strength is doing. So we will measure somebody's muscle strength when we see them in a clinic, and this gives us an indication of how strong they are and whether they're improving their strength, and symptoms of like malabsorption. So if they're getting any unpleasant symptoms, and using those as a marker of, are you absorbing enough of the food that you're eating? And then of course we're focusing really strongly on getting as much out of your food as possible. So fortifying those foods, eating as regularly as you can do, little and often, to get all those extra calories in. That's what we're aiming to do.
Can I add as well? I think So you are right. So that the pancreas does make about 720,000 units of lipase, doesn't it, per meal per day. I think the dosing recommendations came from the sort of theory that if, you know, as Rachel said about how clever the pancreas is in that, you know, it can work quite well until, and it doesn't show those signs of malabsorption until there's 10% of function or less left. I think the doses of Creon, so what we recommend is 75,000 units per meal. It comes from that sort of angle, really, in terms of doses. Does that make sense?
Brilliant. So this is a very good question as well. Is the effectiveness of oral medication also reduced by malabsorption? I'm concerned some symptoms such as nausea, flatulence may not respond to medication.
Sorry, can you say that one again, Jenny?
Sure. Is the effectiveness of oral medication, I presume that's any type of oral medication, or are they just talking about enzymes? I'm not sure. Is the effectiveness of this also reduced by malabsorption? I'm concerned some symptoms such as nausea and flatulence may not respond to medication.
Yeah, no, sometimes, particularly if you, you know, we see delayed gastric emptying or very sort of slow emptying of food, fluids and medications at times, and, you know, absorption and how well those are used by the body can sometimes be affected. So potentially, or it might be that you just need to try alternative medications, so alternative anti-sickness, for instance. If it's Creon related, again, as Rachel said, it might be that you would be better trying an alternative brand of enzymes to see whether that's any better. I hope that answers the question. I'm not quite sure specifically what medication they're talking about there. But.
Yeah, I mean that's true, because we're not quite sure of what specific medication, but thank you for that, Lauren. Another question, I'm 7 weeks post PPPD, which is pylorus preserving pancreatic duodenectomy, I think, and regularly wake up in the night due to abdominal pain, which turns out to be wind and or hunger. I then move around the house and eat a small meal. Is this normal at this stage?
I suppose you're still quite soon post-op, and it might be that you are only managing to eat kind of smaller amounts during the day, and that might be partly why you're waking up overnight and feeling that you've got hunger. So, you know, potentially that could be due to that. What we'd usually see is that over time, the portions that somebody can manage following a PPPD do tend to improve back towards something a little bit more normal. So it's just kind of I guess being patient and getting your portions back up to normal. In terms of the wind side of things, I wonder whether there may be a little bit of malabsorption that you're experiencing there. So as we talked about, different nutrients causing different symptoms with malabsorption. So with fat, we'll see kind of greasy, oily stools. If somebody's malabsorbing carbohydrates, what we tend to see is quite a lot of wind. So if you're having kind of some carbohydrate foods and we haven't got your enzyme dose quite right, what we might see is that overnight you're waking up with the wind due to a malabsorption. So it might be worth just having a bit of a tweak of your PERT medication and see if that helps.
Okay, so that's great. So increase your dose of Creon. Hopefully that will help things with the flatulence and the pain. I'm just going to go down a little bit to one because it's quite an important question, actually, and I think it would benefit everybody. Are there any benefits of following a keto diet whilst undergoing chemo? Now, I know you touched on things in the diet world out there, Lauren, but perhaps you could answer that one because I think it's quite something that will crop up quite a lot. So
yeah, I mean, there is quite a lot of studies and research going in at the moment on sort of a ketogenic diet. there isn't any evidence at the moment for following this type of diet with pancreatic cancer on treatment. The only evidence and sort of cancer, if you like, where a ketogenic diet has been found beneficial is actually in brain cancers to help control seizures. So that's the only tumour group we use this type of diet in at the moment. So at the moment, no, I would say not. It is very sort of restrictive as well, and does require a lot of intensive input from a dietitian. And obviously on treatment for pancreatic cancer, we want to make sure that you're well nourished and you know, doing as well as possible on treatment, and not restricting that diet too much. So I would stay clear at the moment. As I say, it's just used in brain tumours for controlling sort of seizures at the moment. Yeah. Thanks
a lot, Lauren. We have still a few questions to try and get through. So if we don't get through them all, we'll try and answer you individually, folks. And you can, as I said, contact us on the support line as well. Tomorrow at 10 o'clock, it's open. So this is from somebody who says their appetite is reduced, food tolerance has been poor for a while, and recent chemo has made things much worse. Comments appreciated.
I mean, yeah, that it's a very common it's very common, you know, to lose appetite with pancreatic cancer or any cancer itself, let alone when you have chemotherapy and the side effects of treatment added on top as well. So, you know, Rachel's talked about earlier in the presentation about, you know, adopting that little and often approach as much as possible, you know, enriching your food and following food fortification advice as much as you can. It might be that you need some oral nutritional supplement drinks if you're not already prescribed them, to try and help maximize your intake further. Obviously, I'm not sure on your particular circumstances or situations. Sometimes on chemotherapy, if it's appropriate and it's agreed with sort of, you know, patients and oncologists, sometimes we do have to look at sort of, you know, enteral feeding to support through chemotherapy. So that would be feeding using a tube, but I would hope it wouldn't, you know, we'd be able to do something before that stage. If there's any side effects as well from treatment that maybe aren't managed well, so, you know, nausea or sickness or diarrhea, things like that, it's important to speak to a member of your oncology team to try and get those settled as much as possible as well, and finding those right medications for you to allow you to have a little bit more appetite and eat and drink a little bit more.
Fantastic. This question says, I've advanced pancreatic cancer. I'm not having any treatment. I'm eating well, excuse me, but losing weight. I keep upping the amount of creon, but still have slimy stools or diarrhea, approximately 8 capsules for a snack and 12 for a meal. Do I keep increasing the dose and or ask about proton pump inhibitor?
What I would do is definitely ask about a PPI. I think that would probably be the first thing to do, and take your PPI as prescribed by your GP. What you might see is that helps for those enzymes to work a little bit better, a little bit more effectively. So we might see an improvement in those symptoms. It's a little bit of a balance. You're on a fairly high dose. So it would be whether you see any improvement with the PPI, and do you continue to see improvement with your increasing dose of your creon. If you are not seeing an improvement in your increasing dose of creon, again, see if you can try with an alternative, the Nutrizyme medication. That might be something to try. And what we've seen, what I've seen in the past is, if someone's on a very high dose of creon and they switch on to Nutrizyme, we may be able to reduce the number of tablets that they're having because it works better for them. So that would be something to ask. And then think about quality of life. You know, if someone's taking 12 tablets with a meal, that could potentially have a huge impact on kind of food enjoyment, quality of life. It's a huge pill burden compared to your symptoms. So what is most important for you? And it might be that you kind of drop your dose or stick with your current dose and just tolerate those unpleasant symptoms that you're having if you're not seeing any improvement with your PPI, or if you feel that you can manage to take more tablets and that's the most important thing to get on top of, then yeah, it might be worth increasing them.
Of course, is there any merit also in exploring things like bile acid malabsorption, small intestine bacterial overgrowth, or even opening up the capsules to see if that makes any difference at all? Sometimes we find that that can help people. So feel free to, again, get in touch with us on the support line for a more in-depth answer. So a quick one, ladies, how many Creon or Creon for a 40 sip and how many for a 40 juice, please?
Do you want me to answer it? I've had this question today.
Yeah, go for it, Lauren.
Yeah, so the debate of milk versus juice. So we do recommend that pancreatic enzymes are taken with all nutritional supplements, whether they are milk or juice based. So you know, a lot of practice in the past was not to include enzymes with juice base because there was limited or no fat in them, but actually it's important to remember you've still got the carbohydrates and the protein in those drinks that need breaking down. So as Rachel said, so starting doses for nutritional supplement drinks are 1 to 2 capsules, you know, whether it be 25,000 unit Creon or 22,000 unit of Nutrizyme, and titrating up if needed. So practice within our cancer centre is 2 capsules with a milk-based and 1 with a juice-based. Having said that, obviously it depends on your sort of digestion and, you know, your bowels and gut really. It might be that you need a little bit more than that. It might need titrating a bit more, but that's what we would start at anyway.
Brilliant. Ladies, 2 left, so hopefully we can get through them. I had Whipple's 11 months ago. I had VRA and C. difficile from the surgery. I'm now on 40 milligrams of omeprazole a day, 10 loperamide, codeine, cholestyramine, ondansetron, 8 times 25,000 units of Creon with a meal, 6 with a snack. Even with all of this, the person has diarrhea, which has got worse post-chemo, and weight continues to drop. Now classed as underweight. I fortify my food, take multivitamins, etc. I'm currently being stool tested for an inflamed colon. Celiac blood test came back negative. Any hope for me, they're saying?
Again, you mentioned stool sample there. Again, it might be that it needs rechecking for C. diff if that's something that you've had before. If you've been on omeprazole a long time, sometimes switch in PPI. So maybe go into lansoprazole as an alternative, maybe an option. I'm not sure if you've been tested for bile acid malabsorption, although you're on cholestyramine, so I'm guessing that's been considered, but also bacterial overgrowth, whether that's been investigated as well. And I think, you know, it might be that you need sort of further tests, whether it be endoscopy or colonoscopy, or, you know, as the way forward possibly. Also, have other enzymes been, you know, considered? So if you're on Creon, has Nutrizyme or an alternative to those been considered? They would probably be my next thoughts anyway. I don't know if you want to add anything, Rach, to that.
I mean, I think that's what I would have said. So I think that's covered it there. It sounds like you've got a huge amount to contend with there, so that must be really tough. So yeah, maybe try with the alternatives and see if that helps.
Brilliant, thank you guys. And last question, just wondering when you should take, I don't know what PRES means, sorry about that, meds like levothyroxine, when also taking enzymes, i.e. does the drug get destroyed if taken near the enzymes? I presume at the same time they mean. Suddenly my thyroid levels did drop for a while. Taking meds apart from Creon, TSH is, sorry, there's a little typo there. I think they're basically asking, can you take levothyroxine at the same time as enzymes?
I guess so. I mean, there's no, you know, you don't need to avoid taking other medications around enzyme times. It's just important you taking your enzymes, you know, with every meal, snack and supplement really. We've not got any set recommendations on when you need to take other drugs. Brilliant.
I think that's exactly what we'd say as well. It shouldn't affect any other medication that you take. So, phew, that was a whistle-stop tour through all of those questions there. Thanks ever so much to everybody who submitted questions, and they were really excellent questions. So hopefully they were helpful to everybody and not just the people who submitted the questions. We're just about out of time, so I will just say a huge thank you again to Rachel and to Lauren, and of course to everybody for joining us this evening. Thank you also for your kind comments and saying how helpful you found this evening, and don't forget we are available for you to speak to on the support line. We're not Rachel and Lauren, but hopefully we'll do a little bit of a job in helping you anyway. As you leave the webinar, you will be taken to an anonymous feedback survey. Hopefully it won't take too long, a couple of minutes to fill it out. We'd be very grateful if you could do this for us. It would just help us to formulate future events. And we will share the webinar of the video, the video of the webinar even on our website in the next few days. And so thanks a million everybody for joining us this evening, and wishing you a good rest of your evening, and do watch out for future events coming up with Pancreatic Cancer UK. Thank you very much.
Thank you.
Thank you. Bye.